and welcome to the show. My name is Julian Ballantyne. Today, we're going to talk about cancer. Now, it's a fact that over half, which is 53% of the public, worry about cancer every few months or more. Secondly, two-thirds would also speak to friends and family before anyone else if they were worried about cancer symptoms. And the most common reasons for the public cited for waiting to book a GP appointment is they're not wanting to find out bad news and hoping the symptoms would go away by themselves. Now, there are some very interesting findings. And on the panel today, we've got Dr. Gabby McCauley, NHS GP. We've got June Reed, who's a lung cancer survivor, and Bishop Mark Nicholson, who's a pastor at Christian Church in Croydon. Now, that's to discuss the importance of detecting cancer early. Now, Dr. Gabby, maybe start with you. Firstly, when I was little, I grew up in the 60s. When we used to hear the name cancer, we'd think it was an instant death sentence. We certainly know that's not the case nowadays.
Yes, so times have really changed, and I'm so thankful for how science has developed and the amazing doctors and surgeons that we have in the NHS. Nowadays, when cancer is found early, the vast majority of people make a really good recovery and they're able to remove the cancers completely from people. So we've really come leaps and bounds over the last decades when it comes to cancer treatment.
May I ask you, Doctor, when we hear the name cancer, is that a blanket term for many ailments which attack our cells as humans?
No, so cancer is very specific. So in the body, people can get growths that are non-cancerous and growths that are cancerous. Non-cancerous growths are benign growths, which means that they are unlikely to cause a lot of harm, whereas cancerous growths are growths that can cause harm because these cells grow very rapidly and they divide rapidly and they can spread to other parts of the body.
Let me ask you, who is most affected by cancer?
So cancer is actually a condition that affects almost anybody from any background or any group. What we're finding now is that 1 in 2 people will actually experience some form of cancer at some point in their life. There are some groups of people who are at higher risks of certain cancers, but it certainly is something that can affect anyone, so all people should be aware. Cancer is also not just something that affects older people, it can affect young people too. So it's important that everyone is aware of signs and symptoms to look out for.
But what are the signs and symptoms to look out for?
Yeah, so this is a really good question. And with cancer, many of the symptoms can be quite vague or generalized or subtle. So it's important that people know what their bodies feel like normally. And if they feel like something is incorrect, to go with their gut instinct and get it investigated. Many people with cancer may experience tiredness, so they just feel like their body doesn't have as much strength as before. People may feel like their appetite has gone, they're just not eating as much as usual, or they feel full more quickly. Also, weight loss, unexpected or unexplained weight loss can also be a sign of cancer. So they can be very subtle and generalized. But there are certain things that I sort of call red flag symptoms where if people experience them, they shouldn't ignore them and hope that the problem will just go away, even if it happens just once. So bleeding is one of the really important ones that I want people to be aware of. So if people notice blood, so if they cough up a little bit of blood, or they have some blood coming from the back passage, or they notice blood in their urine, or bleeding from the vagina when it's not expected, especially in women who are past the menopause, this shouldn't be ignored. Even if it's just happened once, in some people that is a sign of an early cancer, and that is the time to go straight to the GP because they will be referred for further investigations. And the investigations are very simple. We don't want to miss any cancers, and people will find that their GPs will refer them quickly.
Let me ask you, people are living a lot longer now than they used to, let's say 40 or 50 years ago. For that reason, do you think more people are getting cancer just because of longevity?
I think so, because if you think about the number of years that people live, so for example, in the past, People may have passed away from things like heart disease or diabetes at a younger age, but because their overall lifespan is increased, this is why we are seeing that 1 in 2 people will develop a cancer at some point in their life, whether it be towards the tail end of their life, and some people it's earlier on.
So we talk about detecting cancer early. You mentioned that if you get signs, even just one sign, it's time to do something about it. What are the benefits of detecting early cancer?
So the benefits of detecting early cancer are amazing, because what people will find is that when they are referred down a special pathway, so we have special pathways in the NHS that are specifically designed to detect and diagnose cancer and get people their treatment extremely quickly. It means that when it's caught early, the cancer is localized, so it's in a small area where it can be totally removed by surgery or blasted away by radio waves or chemotherapy, which is chemical drug treatment. The issue with cancer when it is a little bit more advanced is that the cells that are quite aggressive, they may have spread to some of the lymph nodes around the body or other parts of the body. And when it's more generalized, it can be a little bit more tricky for doctors to treat it. But our doctors are absolutely amazing. There are so many different treatments, different drugs, different new groundbreaking treatments that we have to treat cancer. So there are so many different options for people. And I would just encourage people that if they have a small symptom, don't sit on it and get it checked out.
So for the moment, Dr. Gabby, I'll come back to you in a few moments, but let me bring June in now. And June is a cancer survivor.
Thank you for inviting me. It's an honour to be with yourself and Dr. Gabby and Pastor Mark.
Let me ask you, obviously you are a cancer survivor. In the early days, in the early stages, let's take you back. Now, you initially felt very tired and that something wasn't just quite right, which prompted you to call your GP. Can you tell us a little bit about the situation and give us some time frames?
Tiredness just was really, really on a different scale. I worked part-time. I'd come home on a Monday. I would literally have to go to bed. I couldn't cook. I just, wasn't interested in eating. Getting up was a struggle. Being at work was a struggle. Whatever it is, I need to get it tested. So insist on the GP surgery eventually, because I was just struggling so much. I was referred for a blood test. And when that blood test came through, all all the various things that they would test for were off the hook. I mean, one of the things that struck me was that my vitamin D was too high. And I thought, black people don't have vitamin D that's too high. And I think at the time I was taking supplements because I was trying to sort of self-medicate. So a diabetic. So when I was losing weight, I put it down for the fact I wasn't eating. So then a second GP called me and told me what my results were, and she sent me for another blood test, and they came back as just as high. Calcium was high, vitamin D was high. Obviously my sugar levels were irregular. Everything was too high, and then she referred me, and I give thanks to her and the first doctor because they did respond very quickly. She referred me to a clinic at Guy's Hospital called the Rapid Assessment Diagnostic Clinic. And there I was seen by a lovely, lovely doctor. I can't remember the word she used, but she really tried to calm me in terms of not thinking that I was going to die. She didn't use those words, but it was very clear that she would say, whatever's wrong, we're here to get to the bottom of it, and we're going to send you for a series of tests. And she asked me a whole lot of questions as well. I was sent for blood tests. I had PET scans, CT scans, MRI scans, and everything was very, very thorough. And eventually she did call me, and I think I was at work at the time, and she said to me that one of the scans had shown I had a shadow on my lung. And I said, well, that be? And I think, I can't remember exactly what she said, but I was then referred to a consultant at St. Thomas's.
Sure.
And he showed me the X-ray, and he did explain, and he didn't put it in these words. Everybody that spoke to me was very, very careful. And
they're gentle, very gentle with explanations.
Well, actually, they weren't like, this is that, this is this. But they said, it's not like the way I'm going to explain it. But in short, he said, on your right side, in your middle lobe, so that's the middle part of the right lung.
Yes.
That shadow there is a tumour. And the cancer that I was diagnosed with is small cell carcinoma. And as I mentioned, because I'm a registrar, I do see it on death certificates. So I knew it was cancer because I was going to have an operation. That was clear. And I was trying to get a sense of when that operation was going to be. And I was told maybe July. So I was shocked when actually I got the date of, I ended up getting a date of June. But in between times, when they were doing all the scans, they found something on my right tonsil. And again, they took some samples and had some investigative treatments or investigations rather. And so that operation to remove my right tonsil was scheduled. And I was in the hospital dressed in, the operating gown, etc. And I was told that after a bit of a wait that no, they're going to do my cancer operation first. And so literally within 2 weeks...
Was that a shock for you?
That was a shock, because it was literally within 12 days, if I'm honest, of seeing the doctor who was the cancer consultant. I had a date to be admitted to guys to have the cancer operation. So I had the operation, and it was done by a fantastic lung specialist who uses robots.
With a robot.
Yeah, he's a robotic specialist.
Technology,
Amazing. And he was such a lovely person. All the consultants that I spoke to were very, very caring, as I said, and took the time to explain things. So yeah, I had the operation on the 12th of June. And I was in hospital for only about 4 days or so.
In and out.
Yeah, it was basically. And to be fair, I felt a little bit, oh my God, but I could see why, because literally as I was being admitted the day before the operation, there's people coming out and there's people joining me to be admitted. So there was a lot of people on that ward with various forms of cancer, not just the cancer that I had. When they removed the cancer, the tumour, they found it was something called atypical carcinoid, which is the second least aggressive. So I was very lucky. Because I had presented via telephone to the GPs and I was put into the system pretty early, it hadn't spread. They had taken out, my nose, but I was very lucky, so I didn't need any chemo, I didn't need any radiotherapy. So I'm very, very grateful. And although I don't go to church regularly, I am spiritual, and I just thank the Lord because I just had to put my faith in the Most High, because I just really had to kind of just be focused, go through all the procedures, try not to go into into a place of fear, because it's so easy to do that, because of like what you said earlier, in our community, we hear that word and we just think we're going to die. And I just prayed, really. I just really prayed.
Let me bring in our third guest today, in fact. And just for the moment, thank you so much, Jim. We'll come back to you in a moment. Bishop Mark Nicholson.
My name is Bishop Mark Nicholson, and I pastor a church called the Acts Christian Church.
Couple of questions. Now, firstly, thank you so much for coming on. But I need to ask you, because, again, perhaps in a time of need, do you find that most people, or many people, turn to their faith, possibly for the first time, when somebody's got cancer in the family, somebody's not well, somebody's had an accident, somebody's lost somebody? Do you find that the case?
Yes, they hold on to their faith as something that they can look to and personalize. Now, if they have a good relationship with their ministry, their church, and their pastor, they would directly feel encouraged to go and share how they're feeling. We would take the right steps after we've heard what the initial situation might be. If it is cancer, we would encourage them immediately to, seek the physician. And most often would have told us, we've done that.
So how do you support people who come to you when something doesn't feel right? What are the steps that you take? What about the care process that you take?
First and foremost, if anybody comes to us, first they feel they have a relationship. Because back in the day, if somebody did come, my father was the minister before me, if they did mention, in fact, they might not mention that cancer, although it may be cancer, because it was very much a deficit, a taboo in the community. And so they wouldn't talk about it. And so people would speculate, oh, they don't look well. We haven't heard from them. What's happening? I did see them the other day, but they mentioned nothing. Back in my dad's days and mum's days, where it was a taboo, it was something held. And they share it even in their church setting because maybe background or where they're coming from. Moving forward, now we use the pulpit not just to preach that great sermon, but to talk about health and wealth and make sure that we are also trained and have some idea that if there is a possible symptom and somebody comes towards us with this through the relationship, that we are able to signpost them into the right direction. And that's what every minister should be. It's a minister that knows what's going on. He's got his feet on the ground and also share his pulpit with what's happening in the community to make his ministry or her ministry relevant.
Now, what are the most common health questions people in your congregation speak to you about?
Well, I think it is cancer related. And so when you hear those things, if they do come to you and speak to you, it's not always I spiritualize them. And there's loads of scriptures in the Bible that would also encourage. I mean, for instance, from my faith, Jesus recognized that there were sick people, and those sick people needed a doctor. And you'll find that in Matthew 9, verse 12. It is not the healthy who needs a doctor, but the sick. And so that's what we're saying. We would be very quick, obviously, to lay in hands. And I do believe in the power of healing. Of course, I've seen people being healed through the power of God. But we have to work in sync to realize there is a time and a place for everything. A time to refer individuals who may be suffering from certain things, or they may already have referred themselves and may share what the diagnosis is and may also share how they are going through their treatment. And again, that helps me as a minister to be more aware that if something again like this took place with somebody else, I would also learn from that past experience and also encourage them to take those same steps.
A couple of questions I need to ask you now. So in the Black community, question where you are based in Purley and Croydon, quite a large Black community. Are most people that come to your parish Black people?
Yes, I would say yes.
And secondly, do you think that Black people are more not aware about the situation, but are more likely, as June did, to seek help? Because in my experience, that was never the case back in the day. It was a case of, let's put that on the back burner, and something might happen in between, reasons not to go and seek medical professional help.
I think we've moved away from that. We got young people, middle-aged, that are educated, and they will be very clued up these last days to see if something's not wrong, deal with it immediately. They're not going to put it on the back burner. They're not just going to say, well, I'm going to trust God for a healing. I do believe that we've got young people now and people in our ministry that will make the right steps. If it's cancer related, they go and get it sorted out immediately. And most likely will tell the minister that, yeah, I wasn't feeling well. I went to see the doctor and this is what they have diagnosed it to be. I would say, please remember us in your prayers. I don't think we've got anyone who's going to ignore it.
Pastor Mark, I believe you're doing some revolutionary stuff now at your ministry, right?
Yes. What we're trying to do now is bring alongside the professionals alongside on our pulpit. Meaning, if people do have symptoms, what we would do, they may think, what are they? But by having professionals, maybe having a healthy service where we discuss this, we understand there's 1 in 4 Black men who would have could suffer from prostate cancer and die. But how will we know that? So we open up pulpits, bring the professionals in, and we've done this. And it's been amazing to see how many people would have said, Bishop Mark, if you did not have this Sunday, bring professionals and doctors, nurses in to talk about this, I would never have known I had a problem in this area. So it's about us ministers opening the pulpit and allowing the professionals to talk about this. Without no health, you can't have wealth.
It's wonderful to talk to you and to learn that too. Thank you so much for the moment, Bishop Roll. Dr. Gabby, we talk about cancer. We've been talking about cancer for the last half an hour or so. A couple of things to ask you here. Is cancer still the number one killer when it comes to diseases that we get as humans, certainly in the Western world?
Yeah, so in the Western world, we are finding that chronic diseases are the things that tend to end people's lives in the long run, whether this be cancer, whether it be to do with the heart system, whether it be to do with diabetes or the kidneys or the brain, such as dementia. But it is one of the many things that do eventually end people's lives.
So therefore, it's a case of, as Jude did, act now. Don't think it might go away by itself. Don't think, oh, I'm just having an off week. Act now. That seems to be the message. Now, we're encouraging people to go to their GPs, but in reality, it's very hard to get an appointment at the moment, certainly post-COVID. Now, what's being done to improve access to GP appointments? And are we adding to the problem by asking people to contact their GP?
Yeah, so I don't want people to feel like they can't contact their GP because they're concerned about availability of appointments or access. There is lots and lots of stuff that's being done in the NHS to improve accessibility. So, for example, there has been record numbers of uptake of GP trainees who will be coming out of their training programs to graduate as GPs in the next coming years. There's also been lots of investment in terms of building the multidisciplinary team. So now we have lots of different types of health professionals working in GP practices to help support GPs with some things that other people can help with. So their appointments are available to see patients who are concerned about things like cancer. And it's very important that when people are booking an appointment to let the team know if you're worried about a symptom that can be cancerous, and they will prioritize the appointment for people.
So, from what you said before, it's very important to be aware of your body and any changes, however small and insignificant you might think they are. But give us a final word from you.
Yeah, I really just want to run through some symptoms that I think are really important that people are aware of. And I'm going to read from a list because I don't want to miss anything out.
Okay.
Because when people present to their doctors with these symptoms, it could potentially be cancer or something less sinister. But if it is, we want to catch things early. All right. So as I said before, any sort of bleeding, even if it's just once, definitely to seek advice from their doctor. Any sort of vague symptoms like tiredness, loss of appetite, weight loss, or even sweating symptoms. Any unexplained persistent pain you should go to your doctors, or unexplained lumps that you can find in different parts of the body. Any persistent cough. So if someone's got a cough for more than 3 weeks, they definitely should be seeing the doctor about it. And change in bowel habit is a big one. Sometimes people notice subtle changes, stools are a little bit more loose or a little bit harder or going more frequently or less than normal. Please do see your doctor about that if it's persistent. Even indigestion sometimes can be a sign of a cancer, so see your doctor about it. And then finally, prostate cancer is something that really does affect the Black community more than other communities. So it's really important that if men notice a change in their bladder habits, they notice that the stream is not as strong, or they're going more frequently, or any sort of changes to do with the bladder, please do see the doctor to get the prostate examined. We can't just rely on the PSA test. Now, they are very good tests to have done, but if somebody's got symptoms, it must go alongside an examination of the prostate. So I just want to leave that with people, to not be fearful, but to take the bull by the horns and see a doctor, bring someone with you so that you can get their opinion and be referred if needs be.
I think it's fair to say that all of these symptoms you mentioned, the likelihood is it's not cancer. But if it is, we're detecting it early. Is it fair to say that, Dr. Gabby?
You are 100% right. So the symptoms that I have mentioned, the way that they have been categorized by doctors is to make sure that we send lots of people to these clinics, so that we want the vast majority of people not to have cancer with these symptoms, because the people that do have them, we want to pick them up very early. So we cast a very, very wide net in order to catch these cancers very early. So I just want to reassure people that if they are referred to a cancer clinic, the likelihood is that they don't have cancer, but some people do, and it means that we can treat them quickly and effectively.
Can I just say that it's been wonderful speaking to you, and I've learned so much. I think that you've reiterated, along with Bishop Mark Nicholson, the fact that if you've got any concerns, go and see a health professional. You know, what's the worst that can happen? The best that can happen, as we talk about, early detection means far better rates of success. And somebody that proves that and shall have the last word is our very own June. June is, of course, a survivor. But Dr. Gabby, for the moment, thank you. June, let me bring you in just at the end here. I want it from your mouth and not mine. It's your experience. You are a survivor. What would you say to anybody that's got any concerns about their health at the moment? What would you suggest, June?
I would really encourage them alongside what Dr. Gabby said and Pastor Mark. But because I went very early, the tumour was very small. It hadn't spread. And that led to me, I think for the time being anyway, recovering and feeling much better. So don't worry, take action, go to your doctor, insist on being seen, insist on having blood tests, because the blood test will show whether you're fine or whether there's something a little bit untoward. Don't shy away from it. Get yourself seen, get yourself checked by a medical professional. I can't encourage that more.
Speak to you. I'd just like to say thank you to Dr. Gabby McCauley, June Reed, of course, and Bishop Mark Nicholson for sharing their stories and sharing their time with us. If you'd like to know any more information on the cancer signs and symptoms, search online nhs.uk/cancer symptoms. I look forward to speaking to you very soon from this seat, but for the moment, thank you very much. See you soon. Take care. If you've got any doubts at all, get tested. Bye-bye.